Sports physiotherapy is one of the most misunderstood areas of healthcare in Malaysia, and that misunderstanding is keeping a lot of injured people from getting the right treatment at the right time. The most common misconception is that sports physiotherapy is reserved for professional athletes with serious structural injuries, the kind of thing that ends seasons or requires surgery. That is not what sports physiotherapy is for. Sports physiotherapy is appropriate for anyone whose pain, limitation, or recurring physical complaint is connected to sport or physical activity at any level of participation and for any severity of problem. Whether you play weekend badminton, jog 3 times a week after work, attend gym sessions, play recreational futsal with colleagues, or cycle for fitness, you are the patient sports physiotherapy exists to treat. The question is not whether you are competitive enough or injured seriously enough to deserve specialist attention. The question is whether your body is doing what you need it to do, and if not, whether a physiotherapist with sport-specific training can change that. There are 3 clear signs that sports physiotherapy is the right next step. The first is pain or discomfort during or after physical activity that has been present for more than 2 weeks without consistent improvement. 2 weeks is the clinical threshold because it is the window within which most acute soft tissue injuries, muscle strains, minor ligament sprains, early joint irritation should begin showing meaningful spontaneous recovery. If yours has not improved in that time, something specific needs to be assessed and addressed. Rest alone will not change a condition that has failed to improve over 2 weeks of rest. The second sign is a recurring pattern. The same injury or a series of injuries in the same region that keep coming back every time you return to training is not bad luck, and it is not an inevitable feature of being active. Recurring injury means the root cause was never properly identified, and so the same structural vulnerability is being exposed to the same loading pattern over and over. A thorough sports physiotherapy assessment specifically looks for that vulnerability, the muscle imbalance, the movement dysfunction, the restricted joint, the biomechanical pattern that is driving the recurrence rather than just treating the latest episode of it. The third sign is avoidance. You have started modifying how you move, shorten your training, or stop certain activities entirely because you are afraid of making something worse. Avoidance leads directly to deconditioning, which weakens the very structures you are trying to protect, which makes the injury more sensitive, which deepens the fear, which widens the avoidance. Sports physiotherapy breaks that cycle from the first assessment. When you attend a sports physio session in Malaysia, the clinician starts by understanding your specific sport, your training load, and the exact movement demands your sport places on the injured structure. A knee complaint in a badminton player is assessed and treated differently from the same knee complaint in a runner or a futsal player because the patterns of load, lateral explosiveness versus repetitive forward propulsion versus deceleration on a hard surface are completely different. The sport-specific calibration is not cosmetic. The exercises you are prescribed, the loads used in rehabilitation, the return to sport criteria you need to meet, all of it reflects the actual demands of your activity. This is why generic knee exercises from a search engine are rarely the right answer for a court sports player, and why a physiotherapist who understands your sport designs a program fundamentally different from one that does not. You do not need a referral from a doctor to access sports physiotherapy in Malaysia. You can find a clinic, call or book online, and attend your first appointment directly. The absence of a referral should never be a reason to delay getting assessed. You will leave your first appointment with a clear explanation of what is wrong, a realistic timeline for recovery, and specific exercises to begin that day. Return to full training is not declared when you feel good. It is tested objectively against established criteria before you are cleared. Sports physiotherapy in Malaysia runs between 100 and 200 ringgit per session, with most conditions resolving in 4 to 8 sessions when started early, rather than after months of self-management. The link in the description explains the full scope of sports physiotherapy in Malaysia and how to find a qualified practitioner near you. If you have a niggle that has been there for more than 2 weeks, the most useful thing you can do today is book an assessment rather than continue hoping it will resolve on its own.